Australia's path to recovery is now at a crossroads, with whole suburbs in Melbourne declared a health risk.
As we open up, we're going to hit a point whereby the virus says that's enough opening up and off it goes again. And this will happen again and again and again in the next 12 to 24 to 36 months till we have a vaccine. That is our new reality.
What's worrying medical experts is a sudden rise in the number of infections spreading within the community.
Hi, my name is Luke and I'm 21 and I just got tested positive for coronavirus 3 days ago.
Luke Marin is among the latest positive cases.
So I just woke up Saturday morning and I had a fever and I went to get tested and I didn't think I had it, but 3 days later, I got a call and they say I've got coronavirus. I still have a cough, sore throat, stuffy nose.
Luke thinks he was exposed to the virus while out shopping.
Now all my friends are getting tested too, and my family as well.
And as restrictions ease, he says everyone should maintain their vigilance.
The fact that I went out is probably the reason that I got it. If I had stayed at home, I wouldn't have got it.
And he says people should download the COVID Safe app.
I didn't consider downloading it for fear of invasion of my privacy, but now I'm thinking that it's probably a small sacrifice for the benefit of knowing if there are people around you that could be potential spreaders.
Several infection clusters have been traced to separate families across multiple households, the two largest in Keilor in Melbourne's northwest and Coburg in the north.
And what we have been told is that those families weren't obeying those rules. We would also have to assume that perhaps the public health workforce was also not perhaps getting out there as much as possible to talk to these people and explain what isolation means. We have been told today that there is a lot more action with more public health workers going out into the field and explaining exactly what isolation means.
Epidemiologist Professor Tony Blakely says discouraging people from travelling between 6 suburban areas will help stop the spread.
If that's not enough, we can just keep increasing the stringency of those criteria and basically going into a harder lockdown if necessary.
What we have for dinner anyway?
Tonight?
Yeah.
I think we might have some fish and soup.
I'll have a fish.
In the face of a possible second wave, many are now taking extra precautions.
But I can always go out.
No. You don't want to go out.
They gave us the first lot and frightened all our socks off us. And now, when they talked about bringing it back, sort of, you've got to be careful and stay home and all that.
Mike and Mary Wall in Melbourne's southeast are vulnerable to COVID. Mike has mesothelioma.
I have got asbestos in my lungs. I don't think it's going to get any better. It probably puts me at a higher risk than a lot of people.
I don't know how I'd be if I didn't have Mike. I'd be in just the same as everybody else. Worried silly. They're telling you all this news, how bad it is, and people are frightened, and it frightens you.
The spike in cases has stalled Victoria's plans to reopen the economy.
The only thing that I can see getting Victoria out of the situation we're in is some discipline and maybe some hardline tactics in terms of stopping people from ignoring social distancing.
Henry Brooks and Lily Stokes own a restaurant in the suburb of Brunswick. Now that it's been declared a COVID hotspot, they've had to delay plans to increase the number of diners.
We had some, large bookings that people who missed out on celebrating events like 30ths and weddings and things like that, they'd booked in, over the next few weeks for groups of 20, which would have been a great experience for us and them alike. But now we've had to wind that back again and sort of postpone to further down the line.
We just want to get back to the sounds and the feeling of being in a busy place, but we still have to wait.
The stop-start is absolutely not viable.
I wanted to walk through and tell you about what we were planning on doing with this area in terms of overflow.
Intensive care units around the country have plenty of capacity if a second wave hits.
Now that we've seen what's happened and we've been able to prepare better, we've been able to get ourselves ahead of the game and essentially know what we're going to do each step of the way.
At Monash Medical Centre in Melbourne's southeast, they're ready for any severe cases.
A lot of us went through a great amount of anxiety and we were all quite scared looking at all the footage from overseas about what was potentially going to come to Australian shores, and I think we all dealt with it by doing, trying to get ready and to prepare for what's going to happen, and I think what we've been through already has given us a good idea about how to cope with any other escalation.
The big test now will be whether Victoria has done enough.
If it takes tightening the restrictions again to control the spread, then it's probably necessary.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.